I was mentioning that I was recently in Nigeria last week, actually got home yesterday, and what I found was a lot of the patients that I was seeing in Nigeria, the women were suffering with fibroids. I noticed a significant amount of discussion and talk around fibroids. And men, a decent amount of them suffering from impotence. And both of those being hormone-related conditions, sex hormone-related conditions, either high or low testosterone, estrogen, or progesterone. And what we realize is a lot of these cancers or disease states related to the sex hormones are related to their imbalance, to high estrogen, to low testosterone, to high testosterone. And it's really important to understand how to create balance amongst the hormones in order to reduce the risk of disease or be able to reduce the impact, the condition, if you already have it. So I wanted to spend some time because I promised some of my Nigerian friends that I would produce some info for them to understand how to better deal with uterine fibroids. So I did a deep dive on some of the research and found some really interesting information. First off, I was very impressed with the amount of impact that just cleaner diet and exercise can have on the creation of fibroids and the proliferation of their growth. The research showed that eating lower glycemic load foods, which are foods that have less impact to your blood sugar levels, those would be more of the vegetable intake. The foods wanting to decrease are those like the simple sugars, the cake, ice cream, cookies, potato, rice, breads. The high impact carbohydrates is what you want to reduce, and what you want to increase is your intake of vegetables. Okay, so make that change. We'll have a decrease in the proliferation of the fibroids and the actual size of the fibroids. The other thing was exercise. I couldn't believe the impact exercise simply has on uterine fibroids. So before you do anything, surgeries, medications with significant side effects, start with making sure you have your diet dialed in, and start, if you haven't started, doing more exercise. So, and the reason why the diet is so important is because the higher your blood sugar levels, the higher insulin will go. And for those docs that may be watching, when insulin goes high, your sex hormone binding globulin, which is the protein that attaches to sex hormones, goes down, allowing more free sex hormones. So whether it raises testosterone, estrogen, or progesterone, we don't want excess of anything, including our hormones. Yes, many people are dealing with hormone levels that are too low, but the same concern we will have when the hormone levels go too high. So keeping blood sugar level will keep your insulin in check, and insulin will keep your sex hormone binding globulin balanced. So I did some research on the nutrients and found out that there are 3 primary Aceva products that can have a pretty significant impact on uterine fibroids, and I want to discuss those real quick. And sorry for any sounds outside. Again, I couldn't resist coming outside in such a beautiful day. But the first one would be green tea extract. There's a compound in green tea extract, galactocalate. If you can say that better than me, I give you a prize. It's ECGC is what I know it as. ECGC is a compound. It's actually a flavonoid found inside green tea extract, and it's amazing. It has effects on, it's an antioxidant, which reduces your risk of cancer. It's an anti-inflammatory, so lower inflammatory levels, which is crucial in fibroids. And it has anti-tumor properties, which can have a significant impact on fibroids. That's research in 2012 and 2013. But they actually did a randomized placebo-controlled study. So there's an advanced study on the effects of taking 800 milligrams of green tea extract a day and its effect on fibroids. And what they did is they checked 39 women with symptoms of fibroids. And what they found was it caused a 32% reduction in two things: fibroid volume, the size of the fibroid itself. Think about it, a third decrease in the size just from green tea alone. And second, it caused the same, a 32% reduction in the severity of the symptoms, which could be blood loss, cramping, pain, and other issues of fibroids. So you get a double effect with just green tea extract. Now, it had to be green tea extract that contains 45% ECGC, which is the exact amount of ECGC found in Metatrim, which is the Aceva product that is primarily used for weight loss. Now, here's a beautiful impact here, is when you're taking Metatrim for fibroids, Metatrim also helps the mobilization and burning of fat. Why is that so crucial? Because the higher fat you have, the higher aromatase enzyme that you have present in your bloodstream, which converts testosterone to more estrogen. When that estrogen starts to climb, it can increase the size and volume of your fibroids, or create more fibroids, or just initiate the process of getting fibroids. So we not only have the green tea extract needed by research levels to reduce fibroids, but it's also going to help in weight reduction. Now, you can't just take the product, you have to work on the dietary changes we said and implement exercise. But Metatrim will have a dual impact, can have the potential, according to research, to reduce the size of the fibroid, the symptoms of this thyroid, both of those by 30%, and help you in the reduction of weight, which has a secondary effect on your fibroids. The other thing that the green tea also did, it provided a significant impact to the symptoms of fibroids, which is anemia and blood loss, and also increased quality of life, according to the study that was done in 2013 by Rashidi. Now, the ECGC did another thing that's very powerful, because fibroids can potentially turn into some cancerous tissue. But green tea extract decreased the growth, inhibited the growth of new blood vessels inside tumors. So if it becomes cancerous, it's not going to grow and proliferate and going to be more malignant, meaning the tumor grow in different areas of your body. So it's a beautiful impact on cancer risk as well. And finally, a study that was done a little farther back in history in 2008 showed that the ECGC significantly reduced both the size and also the number of fibroids. So if you have fibroids, I highly recommend implementing ECGC, which is found in Metatrim. I would recommend 3 capsules twice a day, and to do it according to the impact the study had on those results. They did it over a 4-month period of time, so 16 weeks, 3 capsules twice a day. The second product that had a major impact, according to research, was Active D, which is vitamin D. What they showed is those with lower serum vitamin D levels are more likely to create and develop uterine fibroids. In one study, they showed a significant relationship of vitamin D levels and fibroid size. Correlation: lower vitamin D, larger fibroid. Higher vitamin D levels, smaller fibroid. So that is very powerful. And this was especially evident among black women. The incidence of fibroids is 3 times higher in African or Afro-American women. And that's why when I was in Nigeria, in Africa, I heard a lot more discussion about uterine fibroids while being there. And that just makes sense since it's more common amongst black women. Another study showed that with significant vitamin D levels, you had a 32% lower odds of having that compared to those with adequate levels. Now, they're saying the adequate level is a level of 20 nanograms per milliliter. So anything above that, you'll have a 32% less risk of developing them. Personally, I would like you to have levels between 50 and 80 nanograms per milliliter. okay? So 50 to 80 is what I would recommend as an optimal level. They're saying over 20, you get the results of reduction in fibroid size and amount. Another study showed that women with vitamin D deficiency had a 2.4 times greater risk of having fibroids. And that was in 3 studies, all published in 2013. Another study showing that vitamin D normal concentrations dropped uterine fibroid cells, inhibited the cell growth by 12%. So basically stopping the growth of the cells. So size of tumors would go down. At a higher concentration, and this is also why I'd like you to be at a 50 to 80 level, it showed the inhibition was suppressing growth by 62% versus 12%. So obviously the higher level for all of our health, reduction in cancer, reduction in muscle issues, enhancement of immune function, and so many other benefits of vitamin D. But another one to add to the hat is 62% reduction in the growth of uterine tissue, of fibroid tissue, I'm sorry. The data shows that overall vitamin D is a strong component to help reduce fibroids. And that is Active D. Now, I can't tell you the dose of Active D, the product, the liquid vitamin D that we have at Aceva, because it's best that you do a lab test. Go to your doctor and get your lab test. If you have uterine fibroids, try to raise it to the 50 to 80 level. I would take vitamin D for a 90-day period of time and then retest and see what the levels are. If you want to get the lab test done directly through Aceva, just reach out to support@aceva.com and we can get you hooked up with cash pay, low-cost vitamin D testing. Now the third product, Mobility, in the Aceva line, has a high level of curcumin, which is the active ingredient in turmeric, the spice turmeric. So curcumin has been shown to be a therapeutic agent for uterine fibroids. It actually inhibits uterine fibroid cell growth. And this is newer research back in 2011. So not only, like we said before with the other studies, decrease in size, decrease in symptoms, decrease in blood cell proliferation in the uterine fibroids, but now with curcumin, it's literally inhibiting the cell growth as well. The curcumin also decreased the level of a basically like extracellular, like a protein called fibronectin. And what that does is it will decrease the size of the tumors without affecting the uterine muscle tissue. Now, the issue that I have with a lot of the conventional medical approach is obviously the surgery has side effects, but also the drug therapies have significant side effects. So I prefer if we can do things that have an effect on uterine fibroids and also have a positive effect on your overall health. And that's what we're finding with these 3 products. The dose that I would recommend for Mobility, which is the Aceva product that has a very high level of curcumin, I would recommend 2 twice a day of Mobility and take it for the same 4-month period of time. The research in a lot of those preliminary studies I mentioned is 4 months, 16 weeks before they showed a decrease in the size of the fibroid and a decrease in the symptoms by over 30%, and that was in a 4-month period of time. Now, something to just finish up with here is that when we look at all these hormone-related diseases and symptoms, it's really important to keep balance. And we talked about blood sugar levels early on. The other thing that I just want to bring up is the exposure to toxins, whether it be the pesticides you're spraying in your yard, the perfume you're inhaling, the chlorine coming out of your shower, the pesticides they're spraying over fields near your home, the carbon monoxide that you're inhaling in a city, the plastics that you drink when you use styrofoam cups, or plastics that you get in your food by putting plastic in a microwave or putting hot foods on plastic. All of those things have the potential to increase chemical estrogens called xenoestrogens, and that will create an imbalance between estrogen and progesterone. And like I believe I mentioned earlier, is the medical research had a contradiction. Some were saying it's caused by excess progesterone and we got to lower progesterone. Whereas other studies and articles that are out there in the medical literature are showing no, it's high estrogen that's causing the fibroids. So there's a disparity. The reality is it can be caused by imbalance of the estrogen progesterone. So some say it's high progesterone. Why? Because progesterone, if progesterone goes too high, it will inhibit the death of fibroid cells. Obviously, that's not what we want. Conversely, high estrogen will increase the cell growth of fibroid tissue. So either way, both camps were right. A high of either will cause an issue. So what we're really looking at is balance between estrogen and progesterone. And we also do not want testosterone converting to estrogen. How does that happen? There's an enzyme in fat tissue called aromatase. The more fat you have on your body, the more aromatase you have on your body. The more aromatase you have, the more of your testosterone will convert to estrogen, creating an imbalance between estrogen and progesterone, fueling the creation of fibroid tissue and the continued growth of fibroid tissue. So I want you to be cautious into your exposure to toxins in your home and in your workplace and on your food and things you're breathing in and things you're putting on your skin. So just be cautious of that. So to add to the 3 products that I mentioned, I would highly recommend you go through a cleanse. So we can try to pull the phthalates, the styrene, the chemicals, the plastics and other chemicals from your body to your liver to detoxify and let it come out your stool, your urine, and your sweat to help free your body of the xeno or chemical level estrogens. The other thing that you got to look at, that detox program at Aceva is called the Ultimate Body Cleanse. So if you have fibroids, I would recommend starting with the Ultimate Body Cleanse and then doing a 4-month program of taking Meditrim, 3 capsules twice a day. Active D, I would start at about 5 drops a day and do it for about 4 months, but test your vitamin D levels. You cannot go on a high level for an extended period of time. But if your levels are very low, I'd recommend going to 10 drops a day, but that would be based on your levels. And the third would be mobility, because it has curcumin, 2 capsules twice a day, okay? Adding to that the Ultimate Body Cleanse to remove toxins and your lifestyle change of exercise and a reduction of the high sugar foods, and you have a nice natural approach to the reduction and management of fibroids. Now, in disclosure, this information is education in nature only. Obviously, we'd highly recommend that you discuss any information with your doctor to see what the best approach is in your individual case. Hope that was helpful to you or anyone that you know that may be suffering from uterine fibroids. Enjoy this summer day, and we'll talk soon. If you have any questions about information, please reach out to support@aceva.com.